Welcome back to Insight. We're at Goshen Center for Cancer Care talking to Dr. Fornalik about, first of all, the role that surgery plays in treating cancer. That's, I think, what most people assume is going to happen if you're diagnosed with cancer.
Yeah, exactly. Typically, that's kind of how we start, and then depending on the results of the surgery and depending on the situation, whether the cancer spreads or not, there's some additional treatment involved.
But your, I guess, main area of focus is the minimally invasive surgery, correct?
Right. I do mostly gynecological oncology surgery, and most of those procedures can be done in a minimally invasive fashion. So this way, patient can have less complications and faster recovery.
And so, and that would be true of anything. Is it particularly true though in the gynecological surgeries that you do?
Well, in gynecological surgery, I'm able to do almost 90% of my surgery in minimally invasive fashion. Mm-hmm. In other areas, it's probably the frequency of minimally invasive surgery would not be that high, but it's still a great option.
So when you say minimally invasive, that would mean, you know, I mean, for somebody like me,
right,
an incision would be normally how big versus how?
I see. Well, in gynecology, for open surgery, the incision would be that long.
Wow.
For minimally invasive, that would be probably like 5 small incisions like that.
That's obviously going to speed your recovery.
Oh, absolutely. And there's less chance of complications. Patients can get up basically next day. They need less assistance. So even when they're staying at home, they're more independent. And also from cancer perspective, it allows us to start additional treatment earlier. So mm-hmm. we don't have to wait that many weeks for recovery.
Yeah, I mean, I feel like I should know this just because it's 2017, but what allows you to do minimally invasive surgery? I mean, is that like a little robot going into me, is there? Or is that, I mean, what happens?
Well, that's quite often what we use. It's a robot which is basically like electronic instrument, like electronic arm. And you can have 4 of those electronic arms inside the patient at the same time. And by knowing the anatomy and being able to explore it without making big incisions, making big adjustment, you can do very complicated surgeries. Mm-hmm. And actually you can get to certain details of the anatomy much better than what you could do with open surgery. Wow. Because you are closer to a certain anatomical structure, and you can work far more precisely.
So when somebody hears the word cancer, obviously, you know, a million different thoughts go through their
right.
head. Why is it important to get a second opinion?
Well, because treatment of cancer is very complicated, and there's always many different options. And the ultimate success depends on how you tailor this treatment to this particular patient. And in a lot of situations, the treatment is multidisciplinary. So you need to be able to talk to other physicians, get opinions from other physicians, so you can figure out the right treatment. In our situations, we meet all the time and discuss the care of the patient with many other specialists. And through such a brainstorming, we can figure out what's really the best option.
So it really, here at Goshen, is a team approach.
Yes, that's correct. I think that really works very, very well. And sometimes, you know, if you don't think yourself about certain option, a colleague of yours can bring this idea. And this way we can figure out something that is really unique. And most importantly, it's something that fits the best to this particular patient.
You're going to find cutting edge care here at Goshen Center for Cancer Care. If you'd like to hear more stories about that, you can go over to livestouched.com and learn more. We will be right back on Insight.